Hello, myself Dr. Kirthi Paladugu, Consultant Orthopedic Surgeon, Yashoda Hospitals, Hyderabad City. The point of cross-checking, what we do, every step we do and we cross-check while we are doing it in robotic thing, and the robo machine won't allow us to oversee the bone cuts. Like if at all we have planned for an 8 mm of cut in the bone, if we try to undercut also, it will tell us that we should cut it another 5.5 mm or 1 mm more. And if we are trying to overcut it also, it won't allow us to do it. That is how precise it would be with the help of the robotics. When it comes to the traditional way, we will be using certain external jigs or blocks to cut the bone. And with the help of the saw, we will be cutting it and we will be doing the trial implantation, checking the alignment with the external system, and that is with the eyeballing. Our naked eye has to tell that whether the alignment is maintained or not. That is how it goes. But when it comes to the machine, it's calculation. It's about calculation. If there is a change of around 0.1 degree, 0.5 degrees, that can be checked, and if required, it can be corrected on the table and then placed. Technically and theoretically speaking, as the incision means the bone release or the soft tissue release and the bone cuts on the lesser side, technically the robotic knee replacement pain would be on the lesser side. In our experience, more than pain relief, the more natural feeling for the joint is given with the robotics. We pre-decide what is the amount of bone that we are supposed to cut, how do we balance it, how do you give the more natural feel to the patient, and what is the apt or the optimal positioning of the implant. Everything is planned. Once everything is planned and set, then we are going for the process of cutting the bone or burying of the bone, and then cross-checking it again with the system, the computer, whatever is, with the help of the trackers and the infrared rays, we'll be cross-checking it. Whatever cuts has been done has been precise, and also we'll be cross-checking the range of movement along with the alignment. That is what double checks the process what we do, and then we are giving the most apt thing that a patient needs in a more natural way. That is what the robotics helps into or overtakes the traditional way of knee replacement. With the help of this robotics and optimal placement of the implants, the longevity of the implants will be on the higher side. Nowadays, we talk about how long does a knee replacement last, and every one of us will be talking about 25 to 30 years. It's not just the material what we use, it's about the technique what we are doing, how precisely we are placing the implant, how well it has been balanced is what matters a lot, rather than just choosing the implant. So, a right choice of implant and a rightly balanced knee will give us a long-lasting knee, rather than just going or considering the material what we are using or just the technique what we are doing. The balancing is the most important thing what has to be done in a knee replacement.
Like, comment, and subscribe for more health updates.